This is the real-time tracker for COVID-19. Our system takes information from different sources and databases and it transfers into a visual environment where the decision makers can take action more effectively. We're going to explain the elements on the map. In the following view, we have geometries representing the hospitals, particles representing individuals, and we can click and see further detail. We can see data related to the patient, could be the age, occupation, the status, and the stage. The color bars on the top and the left side are matched with the color on the particle. It represents the status and the stage of the disease. It can be suspicious, COVID infected, in treatment, recovered, or even deceased. Each one of the individuals and the cases is mapped on the visual environment. We can get a closer look at the hospitals represented by the cylinders in the map. The tallest cylinder represents the maximum capacity of the hospital, and we can click and see further detail where we can see available beds, respirators, number of patients they can support, and also the medical staff information where we can see who's available and who's not. We can compare all the hospitals within the city. The bar on the left side, blue colored, it represents the current availability of services. The red one is the prognosis for next week. So we can zoom out and see how the distribution of the medical centers is supporting the population. For this example, we are showing hospitals and cases that are far away. Most of these cases that are in the surroundings should be treated at home, or we can guide using the left bars to see how many patients they are reporting. The heat map on the base of the map shows where other individuals are having transit. We can switch to the cube mode and we can cross information based on geographic data, knowing where there are more inhabitants and the population is more concentrated for some areas. We can find out and detect where could we have higher exposure rates. It helps us to create a visual indicator and know where the population must stop gathering or moving around certain areas based on the exposure level. We are seeing a building or area in this neighborhood that has a higher rate, maybe because populational density or maybe because they haven't ceased the activities. We can zoom out and we can see the entire state and realize in real time and get situational awareness of the infection in progress. The color bars on the left help us know the status of the patients that are being received by each one of the hospitals available. And on the bottom bar, we can see the evolution. At this point, we are looking at a real-time emergency that is coming from a third-party information source. And we are looking at a woman, you can see the medical record and its hospitalization immediately. We can zoom in, locate the case, and get the dispatch units to come and pick her up. We also are proposing to get a tracking of the health services inventory and status. This can help us see not only the situation for the city, but also the resources available. With this visual inventory, what we are doing is tracking three key elements during the pandemic. Each one of the cities is represented by a slice of the pie, but we can zoom in and we can see the top part where we are doing a track for medical resources. We can see the availability and we can see the status of some of the assets that are on the field. The second one is medical equipment. We can see how many tests, respirators, consumables, masks, protective gear, and beds available. As you can see in this example, the masks are in red because we need to put an order for more masks. On the patient side, we can do a live tracking and see who's suspicious, positive, who can become a donor. If we would like to analyze a single state, we can get closer and get detailed information based on the color code, and also when zoomed in we can get tech data related to that data source. The third part is linked to the medical supplies and distribution. It can help us optimize the inventories, but also realize where we have deployed resources on the map. Here we are seeing a peninsula, and we can zoom in and mark the inventories as the cylinder in the middle. In this case, we are running low on a specific medical supply, but we have already delivered and restocked other hospitals. The smaller dots represent kits that are being deployed to fields, clinics, or end user homes. In this case, the inventory is almost full, but we have one that is close by to the left that needs to restock. So we can take decisions and deliver whatever is needed: masks, sanitizers, respirators, and we can get a real time tracking of the solutions or the items available on the field. The next following part of our system allows us to compare visually all the institutions in a certain area. We also like to track the patient's evolution during the pandemics. That can help us add additional layers of information where the patients can become plasma donors. For this case, we have divided days in a timeline, and we are looking at the patients who have been recovered, and in red, the patients who are deceased. The good thing about tracking patients who have recovered is that we can identify them and see them as potential plasma donors for treatment. So the white ones are patients who have performed the test, tested negative. The yellow ones are patients who are getting recovered. Purple ones are patients who have died, and the red ones are in treatment process. We can see an executive resume on the right side based on states and cities. If we get information from additional sources, we can track an entire city. In this case, we are looking at the precinct. Every particle represents the individual living in this area, and we can see their names. For this example, we are gathering sources from elections databases, and we can see who has been infected. We can see populational density, we can see their ages. So if we would like to see a specific age group, we can track and see where in this area, based on the ages, we can have a higher population who could be prone to getting the disease or having an attack that is higher on their problems. With this mobility system, we can track and prevent possible outbreaks. For this case, we have a pool of patients and we are tracking the number of movements that they do around the city. But these patients are active. This person has been in touch with almost 43 people. If we click on them, we can see who's been tested and marked as possible cases and who hasn't. If we zoom in and we go back into the history of a subject, we could track who has been exposed to that person and mark the other potential cases who have been in touch with this subject and gets an infection.